Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is your lung specialist thinking? If your child has asthma, wheezing, and asthma is spreading like wildfire in most parts of the world, if your child has asthma and your lung specialist taking care of your child does not order mold allergy test, food allergy test to find and detect and document the presence of leaky gut state, that's a test, urinary organic acid test, then I'm afraid your lung specialist of your child is not thinking for himself or for herself. This would be considered as a major indictment. In fact, some pulmonologists will take a strong offense at it, and they will say there is no evidence that mold allergy is present. I will tell you that mold allergy was present in all of my patients with asthma, whether they were pediatric patients or they were adult patients. But let's say there are some exceptions, some uncommon exceptions, which I would like to actually hear from. But when the pediatrician or the pulmonologist keeps giving you first bronchodilator drugs, Proventil, albuterol, then he moves on to steroids, inhalers, then he moves on to steroid injections, then he moves on to chemotherapy drugs or drugs like Remicade, that doctor is not thinking for your child. He's thinking for the peer review. He goes to these pulmonology conferences, and everybody in the conferences is always talking about the newer and newer drugs, forms of steroids, forms of chemotherapy which are being used for intractable asthma. Well, first they won't take care of the allergies of the mold allergy, food allergy, gut fermentation, leaky gut state, clot formation in the blood, microplaque formation in the blood, impaired liver detoxification. I'm a pathologist. Every word that I speak here, I have already documented by giving you specific video segments. So I'm not taking cheap shots. I find it astonishing that pulmonologists continue to ignore these facts. And that's because either they are not capable of independent thinking, or because independent thinking is too hard, or it puts them in disfavor with other doctors in their groups. I think it was back in 1978 or 1979, we developed, my colleague Dr. Ramanarayanan and I developed the first microELISA test for diagnosis of mold allergy and food allergy. Indeed, we were awarded the first United States patent for that. We are not business people. We never put it to any use. Couldn't. But as a part of that, I invited one of our pulmonologists. I said, give me 30 samples from your patients with chronic obstructive lung disease or your patients with asthma. Let me do, free of cost to the patient, these tests on a research basis. Every single one of them had IgE antibodies against various types of molds: Penicillium, Mucor, Aspergillus, Candida, Hormodendron. But at that time, it was a surprise to me. He never followed through. I said, how can he continue to use those drugs and hospitalize patients when he knows that there is, to say that there is no evidence in the literature that mold allergy causes asthma, that's sheer nonsense. It's in their literature also. But that's the way things are. The standards of medical care in the United States are not established by conscientious, thoughtful, diligent, hardworking, knowledgeable doctors. They are established by fear profiteers of drug companies. And so I think I'm justified to raise this question. Is the lung doctor for your child with asthma thinking for himself and herself when he does not order mold tests, mold allergy tests, mold toxins test, food allergy test, gut fermentation test? Children's Health Corps was funded and founded by Talat, my wife, and I some years ago with a mission of spreading authentic information for children all over the world. Please forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Please visit our website www.kids123.org. Kids, Kids. www.kids123.org. Should you have this question in your mind, how can I help? Please go to the website. There is an icon on the left side of the home page. Click on it and we give you specific suggestions how you can participate in our effort. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you. Thank you so much.